Atherosclerosis is a specific form of arteriosclerosis. Arteriosclerosis occurs when the arterial vascular system becomes hardened and stiffened, which can lead to restriction of blood flow to the organs and tissues in the body. Atherosclerosis occurs when the arteries become hard and stiff, restricting blood flow from the organs and tissues throughout the body. So our normal healthy arteries are flexible and elastic. That's what allows our blood flow to flow so easily and simple. Atherosclerosis refers to the buildup of fats, cholesterol, and other substances in and on your artery walls, also known as plaque, which can restrict the blood flow. So plaque can burst, triggering a blood clot. Although atherosclerosis is often considered a heart problem, it can affect arteries anywhere in your body. And then atherosclerosis may be preventable, and it is treatable for sure. And just a fun fact, atherosclerosis is most commonly associated with the development of an aneurysm. So causes of atherosclerosis, it's a slow, progressive disease that may begin as early as childhood. Atherosclerosis may start with damage or injury to the inner layer of an artery. Those damages can be caused by high blood pressure, high cholesterol, high triglycerides, smoking and tobacco use, insulin resistance, obesity, diabetes, inflammation from disease such as arthritis, lupus, or infections, or inflammation of an unknown cause. Over time, fatty deposits, also known as plaque, made of cholesterol and other cellular products, also build up at the injury site and harden, narrowing your arteries. The organs and tissues connected to the blocked arteries then do not receive enough blood to function properly. Eventually, pieces of the fatty deposits may break off and enter your bloodstream to cause a blood clot, and then they may even embolize anywhere in your body. So in addition, smooth lining of the plaque may rupture, spilling cholesterol and other substances into your bloodstream. That could cause a blood clot, which blocks flow, and then if it's in your heart, it could cause a heart attack. If it's in your carotids, it could cause a stroke. Blood clot can also travel to other parts of your body, blocking flow to other organs. So symptoms of atherosclerosis, it's usually asymptomatic unless you have a moderate to severe case. Patients usually will not have atherosclerotic symptoms until an artery is so narrowed or clogged that it cannot supply adequate blood to your organs and tissues. Sometimes a blood clot completely blocks blood flow, or even breaks apart and can trigger a heart attack or a stroke. And of course, mild atherosclerosis usually does not have symptoms, like I stated before, because it is a slow progressive disease. And then symptoms of moderate to severe cases depend on which arteries are affected. So if you have atherosclerosis in the coronary arteries or anywhere in the heart, you may have symptoms such as chest pain or pressure. If you have it in the arteries leading to your brain, you may have a mini stroke or stroke symptoms, which are sudden numbness or weakness in your arms or legs, difficulty speaking or slurred speech, temporary loss of vision in one eye, or drooping muscles in your face. If you have atherosclerosis in the arteries of your arms and legs, you may have symptoms of peripheral arterial disease, such as leg pain when walking. If you have atherosclerosis in the arteries leading to your kidneys, you can develop high blood pressure, or even kidney failure eventually. So atherosclerosis is a building block for other diseases in the vessels. So it can also cause different complications. So complications of atherosclerosis depends on which arteries are located, or which arteries are blocked for damage. It could cause coronary artery disease, carotid artery disease, peripheral arterial disease, aneurysms, or even chronic kidney disease. Coronary artery disease is when it narrows the arteries close to your heart and you develop coronary artery disease, which can cause chest pain, heart attack, or even heart failure. Carotid artery disease narrows the arteries close to your brain, and that could cause a mini stroke or a stroke. Peripheral arterial disease narrows the arteries in your arms or legs, and you may develop circulation problems in your arms and legs. And then that can make you less sensitive to heat and cold, which increases your risk for burns or even frostbite. And then in rare cases, but not too rare, poor circulation in your arms or legs, that could cause tissue death, which is also known as gangrene, which could eventually lead to limb loss, toes, fingers, feet, if it's serious enough. Atherosclerosis could lead to aneurysms. Like I said before, it is most commonly associated with the development of an aneurysm. And an aneurysm is a bulge in the wall of your artery. So most people with aneurysms are asymptomatic. They may or may not have pain and throbbing in the area of the aneurysm. But of course it is a medical emergency if it is found before it bursts. And if it does burst, you can face life-threatening internal bleeding. It's usually a sudden catastrophic event, but a slow leak is possible, but it's not very popular. And then atherosclerosis could also lead to chronic kidney disease. That could cause the arteries leading to your kidneys to narrow, preventing oxygenated blood from reaching them, and then over time it could affect your kidney function, keeping waste from exiting your body, and like I said before, it causes high blood pressure and then eventually just kidney failure in general. So when a doctor diagnoses patients with atherosclerosis, they usually do a physical exam, and they do 3 things that can be found in the doctor's office. A weak or absent pulse below the narrowed area of your artery could diagnose atherosclerosis. You could also find decreased blood pressure in an affected limb. And then the doctor could also hear whooshing sounds over your arteries, also known as a bruit, and that's heard with a stethoscope. So if they do diagnose atherosclerosis, they may do further testing, and they could order a blood test, a Doppler ultrasound, an ankle brachial index, an electrocardiogram, and a stress test. So we really focus on Doppler ultrasound, and that helps measure the blood pressure at various points along your arm and leg. Those measurements can help the doctor gauge the degree of any blockages as well as the speed of blood flow in your arteries. And then you can also listen, and the faintness or absence of sound may indicate an obstruction in the blood flow. We could do an ankle brachial index, also known as an ABI. That test can tell if you have atherosclerosis in the arteries in your legs and feet. Your doctor may compare the blood pressure in your ankle with the blood pressure in your arm. That is why it's called ankle brachial index. It's an abnormal difference may indicate peripheral vascular disease, which is usually caused by atherosclerosis. So I mentioned before that atherosclerosis is it may be a preventable disease, but it is a treatable disease. So preventions, it's a simple lifestyle change. Number one, and probably most important, is if you smoke, stop. So smoking leads to plaque buildup in all the arteries or in the vessels as well. Doing something as simple as eating healthy foods, having a healthy diet. As much as we love fried foods and hamburgers, those aren't the best for our body, and that cholesterol builds up and it causes plaque in our arteries and our vessels, and that is what causes heart attacks. Exercising regularly, that gets your blood pumping and your blood flowing, and then maintaining a healthy weight, excuse me. So treatments, the first step to treating atherosclerosis is to keep it from getting worse. You can do this with lifestyle changes, like I said before, exercising every day, eating a healthy diet, maintaining your high blood pressure, your high cholesterol, high blood sugar, stop smoking, tobacco use, etc. Also, in depth with treatments, you could take a low dose of aspirin every day. That aspirin is used as an over-the-counter blood thinner, and that keeps the blood moving and less likely to clot. You could take a cholesterol-lowering statin, an antiplatelet medication, a beta blocker, a calcium channel blocker, water pills, diuretics. That lowers blood pressure. And then surgically, doctors can do an angioplasty, which is a procedure to open blocked or narrowed coronary heart arteries and can improve the blood flow to the heart, relieve chest pain, and possibly prevent a heart attack. And then sometimes when they do angioplasties, a stent is placed in the artery to keep it open after the procedure. They could also do a coronary artery bypass grafting. That's a type of surgery where arteries or veins from other areas in the body are used to bypass the narrowed coronary arteries. It can improve blood flow to your heart, relieve chest pain, and also possibly prevent a heart attack. And then you could also have a bypass graft in your leg arteries. With this surgery, a healthy blood vessel is used to bypass a narrowed or blocked blood vessel in one of the legs. The healthy blood vessel redirects the blood around the artery and improving blood flow to the leg. So I always think of that as like a detour around a traffic jam. That's basically what a bypass is.